Good afternoon. Today we'll be talking about natural history of disease. Content of this lecture will be introduction, models of disease causation, factors of disease causation, natural history of disease in man, levels of prevention, and quantifying prognosis. To define, natural history of disease refers to the progress of a disease process in an individual over time in the absence of intervention. The process begins with exposure or accumulation of factors that would be capable of causing disease. And without medical intervention, we would have three outcomes. It could either end in recovery, disability, or death. So once we get exposed, we have the host producing disease, and therefore one would either recover, would be disabled, or die from disease. So knowledge of the natural history of disease would rank alongside understanding importance so that we could prevent disease and control its spread. Natural history of disease is one of the major elements of descriptive epidemiology. The difference between preventive medicine and community medicine with the hospital setting is that you see in the hospital just episodes of the disease, wherein in the community you see it in a setting wherein you feel the knowledge of the whole natural history of disease. And this spectrum proposes challenges to the physician and to the public health worker. Clinical spectrum means from diagnosis, which would only represent a tip of the iceberg. Many additional cases can be seen in the community undiagnosed or too early to be diagnosed or remain asymptomatic. For the public health worker, the challenge is persons with undiagnosed infections may nevertheless be able to transmit them to others. Case in point, coronavirus. Most of us may be asymptomatic, but it is the immunocompromised or elderly who manifest the disease. Hence, the decisions of many countries to go into lockdown. This iceberg concept of disease merely shows that we could be exposed without being infected. Then our infection would be subclinical, meaning it would not show any clinical signs. Then there would be mild illness, severe disease, and eventually lead to death. We follow a lot of models of disease causation. Germ theory, epidemiological triad, and tetrad, beings theory, and web of causation theory, and wheel theory, which we will discuss. First is germ theory of disease, which was proposed by Robert Koch and Louis Pasteur. It states that every human disease is caused by a microbe or germ, which is specific for that disease, and one must be able to isolate the microbe from the diseased human being. Examples of which may include tuberculosis, pneumonia, caused by different types, or COVID-19 as the most recent example caused by your SARS coronavirus 2. Your epidemiological triad is composed of your environment, agent, and host. The three must be existent for disease to occur. Your agent or your vector penetrates the host and brings about the bacterium or the virus, creating disease. Your environment makes it favorable for the agent to meet the host, therefore creating a situation where disease will occur. So what is an agent? It's an element or substance, whether inanimate or animate, that may initiate or perpetuate a disease process. It could either be a single agent, number of independent alternative agents, or two or more factors combining, which is essential for the development of the disease. So there are different classifications of agents. We would have biological agents, nutrient agents, physical, chemical, mechanical, or absence or insufficiency or excess of a factor, and social agents. So we have different agent characteristics. Infectivity refers to the proportion of exposed persons who become infected. Pathogenicity refers to the proportion of infected persons who develop clinical disease. And virulence refers to the proportion of persons with clinical disease who become severely ill or die. So for example, hepatitis A virus in children has a low pathogenicity and low virulence, since many infected children would remain asymptomatic and few would develop severe illness. In persons with good health, measles virus has high pathogenicity but low virulence, since almost all infected persons develop the characteristic rash and illness, but few develop the life-threatening presentation of measles like pneumonia or encephalitis. In patients with poor nutrition and health, measles is more virulent disease with mortality as high as 5 to 10%. Same way with the coronavirus pandemic, it could be considered as a high infectivity but low virulence. However, with people who are immunosuppressed, elderly, case fatality may be higher. A highly virulent and a highly pathogenic virus is rabies, since virtually 100% of all infected persons would eventually progress to clinical disease and death. Then we will have our host. So in epidemiological terminology, the human host is referred to as the soil and the disease agent as the seed. So a host is a person or other living animal that affords subsistence or lodgment to an infectious agent under natural conditions. Host factors. There are intrinsic factors that influence an individual's exposure, susceptibility, or response to a causative agent. Then we have our environment. It could be a physical environment, so it's your non-living thing and physical factors that could spread the influence of disease. Or biological environment, your microbial agents present in the environment. Or your psychosocial environment, which depends on the lifestyle, social class, urbanization, community life of an individual. So for example, in tuberculosis, it's Mycobacterium tuberculosis would meet your host. What would be susceptible to bacteria such as this would be decreased immunity, malnutrition, being elderly, and more recently, HIV infection. Environment factors. You want to avoid poor housing, overcrowding, poverty, and urbanization. When all of these three interplay and meet each other, then you get tuberculosis along with its other risk factors. Your tetrad adds one component to your epidemiological triad, and that is time. So you still have your agent, you have your host, you have your environment, but you have time as a factor. So disease occurrence occurs in different communities and it will show different patterns of expected occurrence. So it could be endemic, it's habitual presence of a disease within a given geographic area. For example, in India, it's chikungunya, which is endemic there, among other diseases. Hyperendemic, it's a persistently high level of occurrence of disease. And sporadic, an irregular pattern of occurrence with occasional cases occurring at irregular intervals of disease. And there is epidemic. So its occurrence in a community or region of a group of illness of similar nature, clearly in excess of normal expectancy and derived from a common or from a propagated source. Public health officials would often use the term outbreak, which means the same thing because it is less provocative to the public. When it spreads over several countries or continents, which affects a large number of people, it would be then called a pandemic or a worldwide epidemic, which we are experiencing now with the coronavirus. Then we have the being's model of disease causation. So this concept postulates that human disease and its consequences are caused by a complex interplay of 9 different factors. Biological factors, innate in a human being, behavioral factors, comprising of one's lifestyle, environmental factors, immunological factors, nutritional, genetic, social, spiritual, and services. Each one would play a role in increasing or decreasing occurrence. The previous theories could easily explain communicable disease, but non-communicable disease are a different matter. It would have many more causes and no infective agents that would explain the presence of disease. Hence, the theory of web of causation was used. What is the web of causation? It theorized that the various factors are like an interacting web of a spider which may cause disease. So each factor would have its own relative importance in causing the final departure from the state of health, as well as interacting with others and modifying the effect of each other. So for example, this would be your web of causation for obesity. So some would say lack of physical activity, heredity, hypertension, hypertensive disease. Your hormones are part of it, smoking would be part of it, and each would be interplay or affect one another in leading one to the other. Another example of web of causation would be tuberculosis. So your host, which would be susceptible because of overcrowding, malnutrition, etc., genetic, may be counteracted by vaccination. Then you get exposed to the mycobacterium. Then you would have your infection. You have your tuberculosis, eventually your disease, and tissue would be invaded and would react to the body. So how is it applied? So your epidemiologic triad is devised to enhance search for a communicable disease, while your web of causation is more or less for non-communicable diseases, which could also be applied to communicable disease as well. Wheel theory. So as medical knowledge advanced, an additional aspect of interest came into play, and that is the comparative role of genetics in the environment as cause of disease. So this triad as well as the web theory does not adequately cover up this differential. To explain such a relative contribution of genetic and environment factors, the wheel theory has been postulated. And what does this say? The theory visualizes human disease in the form of a wheel, which has a central hub representing genetic components and the peripheral portion representing the environmental component. Like a wheel, the outer part has spokes and the environmental component is also divided into three subcomponents representing social, biological, and physical components of the environment. So that's the wheel theory. So the inner part is your central core, your genetic component, which is affected by three different factors, your social, biological, and physical. So these are three different examples of wheel theory. The first one would be a phenylketonuria disease, which is a genetic disease, which shows in your wheel theory that the inner core, which is your genetic component, plays a huge part in the disease. Your diabetes mellitus somewhat has a balanced wheel theory with a genetic component as well as social and lifestyle component, which is shown in this slide. Malaria, which would be basically a communicable disease, would have less risk factors genetically and would largely depend on your social, physical, and biological factors, hence your ability or your risk factors to contract the malaria as a disease. So what are the different factors of disease causation? So there are predisposing factors. These are factors which create a state of susceptibility so that the host becomes vulnerable to the agent or to the necessary cause. For example, age, sex, previous illness, or race that may predispose one person to be more susceptible to a certain disease. Enabling factors are those which assist in the development of or in the recovery from the disease. For example, housing conditions, socioeconomic status, etc. And precipitating factors are those which are associated with immediate exposure to the disease agent or onset of disease. For example, drinking contaminated water, close contact with a case of pulmonary tuberculosis, and the like. There are reinforcing factors. These are those which aggravate an already existing disease. For example, malnutrition and repeated exposure. And risk factors. This is defined as a condition or quality or presence of which increases the chances of an individual to have or be affected by a disease process. A risk factor is not necessarily the cause of a disease, but does increase the probability that a person exposed to the factor may get the disease. So for example, you get exposed to TB. It's either you become infectious or you don't become infected. 70 to 90% will not get infected, while 10 to 30% will do. These are your immunocompromised hosts. 90% of those would have latent TB. They will never develop TB, they will not have symptoms, and they will not be infectious. Only 10% would proceed with active tuberculosis, 5% of which would develop within 2 years, and 5% would develop many years later. You could be either treated or be untreated. If you undergo treatment, you'll be cured. If tuberculosis would be under treatment, 50% will die within 5 years, 25% will remain sick, and 25% will recover. So remember our 3 outcomes of disease. So the natural history of disease in man could be shown in this following slide. There's a preclinical phase and a clinical phase. So point A is biologic onset of disease. P is pathologic evidence of disease. S is signs and symptoms of disease. M is medical care sought. D is for diagnosis, and T is for treatment. What we often see would be the clinical phase of the disease. What preventive medicine is trying to tell you that intervening is easier in the yellow line, where disease has not produced signs and symptoms in your body, in your patient's body, hence it is more controllable. So you have your pre-pathogenic period and your period of pathogenesis. So before any symptoms occur and you're just exposed to the pathogen, no signs of symptoms. And that is where we aim to intervene. Same way with this slide. So disease has an incubation period, a latent period, total period of infection, and period of communicability before you become afflicted with the disease. Problem with the coronavirus, most of us carriers would be asymptomatic with a incubation period of up to 14 days. So this lockdown aims to kill all those bacteria by social distancing, such that the virus would not have a new host to latch onto. Hence, social distancing as a means of combating the novel coronavirus. And these are the stages for natural history of disease in any disease in man. So what could we do in the pre-pathogenesis period? It would be health promotion, such as health education, provision of adequate housing, counseling, and genetics, and specific protection. When once it becomes clinical, we have to have early diagnosis, we have to prevent disability, and we have to have rehabilitation. So these 4 stages of information development take us from recognition of a health problem through its solution, evoking the philosophy and work of the Centers for Disease Control and Prevention. They constitute the public health approach to problem solving. The first two stages fall under the realm of descriptive epidemiology. Stages 3 and 4 involve analytic epidemiology with its capacity to evaluate both cause and effect relationships and interventions based on this etiological understanding. Etiology is the science of causation. So, in this public health approach, for example, if we use coronavirus as an example, surveillance, what's the problem? So we see each case erupting in different countries one by one. We monitor the cases, where they come from, what are the symptoms. Then we identify risk factors. That's part of descriptive epidemiology. Then you analyze so that you could intervene and implement treatment or intervention. And then we have levels of prevention of disease. So primordial prevention is prevention of the emergence or development of risk factors. These are particularly useful for chronic diseases. Example, so many adult health problems have their early origins in childhood because this is the time when lifestyles are formed. So efforts are directed towards discouraging children from adopting lifestyles. Main intervention is through mass education. Primary prevention, these are measures of prevention undertaken during the phase of pre-pathogenesis. So it involves two substeps. It basically involves health promotion and specific protection. Health promotion are steps undertaken to improve the level of general health and well-being so that conditions for initiation of disease process are prevented. So these steps are not specific for any disease or a group of disease. What are the examples of primary prevention? It would include improvement in the overall socioeconomic status of the population, health education, feeding programs, promotion of breastfeeding, promotion of small family norms, education, and motivation for a healthy lifestyle. Specific protection, on the other hand, includes measures to prevent the initiation of specific diseases or a group of diseases. Examples would be immunization, fortifying foods with nutrients, use of condoms to protect against STDs, and use of helmets to protect against head injuries. So both health promotion and specific protection are types of primary preventive strategy. However, health promotional approach improves general health so that a number of diseases are aimed at. For example, promoting breastfeeding among children, we try to prevent general malnutrition, deficiency of vitamin A, providing antibodies against various diseases, and preventing diarrhea. On the other hand, when condom is used, it is for a very specific group of diseases such as STD. So when measles vaccine is given, it is for a specific disease. So you have your two types of strategy. It could be either your population strategy, wherein you target the whole population, or you just identify people at risk. So advantages and disadvantages. So for population, it's radical, large potential for population, behaviorally appropriate. Disadvantages, it would have small benefits to the individual, poor motivation of subject and the physician, benefit to risk ratio may be low. For high risk strategy, it would be appropriate to individuals, subject motivation, physical motivation, benefit to risk ratio is favorable. Disadvantages, high screening cost, it would have temporary effects, limited in effects, and behaviorally inappropriate. Preventive measure which brings much benefit to the population often offers little to each participating individual. Classical example is the Framingham study. Data from the study suggests that if all men up to age 55 reduce their cholesterol level by 10%, 1 in 50 could expect to avoid a heart attack on average, yet 49 out of 50 would follow the same measures and perhaps get nothing out of it. So for example, this lockdown, how many cases have we had? For example, in the Philippines, we've had 217 so far. And yet the whole island of Luzon, comprising of about 5 million people, are in lockdown. So risk to benefit ratio still remains to be seen. But of course, this is a different thing because this is a pandemic. Secondary prevention. This would include all actions undertaken at the stage of early pathogenesis with a view to halt the progress of disease at its earliest by early diagnosis and prompt treatment. Classical example of which is screening for disease such as breast cancer and cervical cancer, either using mammography or pap smear, or annual exams when you go to school, or physical examinations for workers. Tertiary prevention would include all measures undertaken when the disease has become clinically manifested or advanced, with a view to prevent or delay death, reduce or limit impairments and disabilities, minimize suffering, and to promote the subject's adjustment to irremediable conditions. Tertiary prevention has two types of approaches: disability limitation and rehabilitation. Disability limitation. This includes all measures to prevent the occurrence of further complications, impairments, disabilities, and handicaps, or even death. Example. So, application of plaster cast to a patient who has suffered fracture is done to prevent complications and further disability. Complete rest is given to a patient with acute MI to prevent death or sequence with which a disease turns into handicap is as follows. Disease, it's a process and its manifestations which indicate a departure from the state of perfect health. Then you have impairment. This is the actual loss or damage of a part of body anatomy or an aberration of the physiological function that occurs consequent to a disease. Disability, so it's the inability to carry out certain functions or activities which are otherwise expected for that age, sex as a result of the impairment. And handicap, this is the final disadvantage in life which occurs consequent to an impairment or disability which limits the fulfillment of the role of a person required to play in. The second component of tertiary prevention is rehabilitation. It stands for the combined and coordinated usage of all available medical, social, educational, and vocational measures for training the person to the highest level of functional activity. Medical rehabilitation is done through medical and surgical procedures to restore the anatomy, anatomical functions, and physiological functions to as near normal as possible. Vocational rehabilitation includes steps involving training and education so as to enable the person to earn a livelihood. Social rehabilitation involves steps for restoration of the family and social relationships, and emotional and psychological rehabilitation involves steps to restore the confidence, personal dignity, and confidence of a person. This is a summary in tabular form of your levels of prevention: primordial, primary, secondary, and tertiary. Remember your P as prevention, S is for screening, and T is for treatment, and you'll never get lost. So the phase of disease and the target of the disease is tabulated for each level of prevention. This would be a summary of all the slides that we have discussed for this lecture. And quantifying the prognosis is a quantitative expression of the likelihood of a specific outcome or survival. So, prognosis, death, survival, CFR is case fatality rate, and survival would be percentage of surviving after you get a certain disease. For example, coronavirus has a case fatality rate of around 3 to 4%. If you will remember your biostatistics, case fatality is defined as number of people who die of a disease as to the number of people who have the disease. For example, 200 people with the disease over 20 deaths. So, 20 out of 200, then case fatality rate is at 10%. 5-year survival rate is the proportion of patients who are alive 5 years after diagnosis. So, number of persons with a specified disease surviving for 5 years over the total number of persons with the specified disease. 5-year survival rate widely used in cancer studies and chronic disease. So, lead time. So, lead time is the time between the early detection of disease and the time of its usual clinical diagnosis. Lead time bias occurs because of the failure to account for the lead time when calculating survival. Observed survival rate. The observed survival rate is an estimate of the probability of surviving. This probability can be calculated using the technique of life table analysis. Advantage of using data on all patients regardless of how long they survive. Median survival times, the length of time that half of the study population survives. Advantage over mean survival, less affected by your outliers, and you have to study only half the group. Relative survival rate is the ratio of the observed survival to the expected survival rate. It compares survival in the study group to the survival of a comparable group without the disease of interest. It removes the observed survival, the effect of deaths from all other causes, and comparison group consists of persons in the general population, similar to the patient group with respect to age, sex, and age of observation. Thank you for listening. This is our first online lecture. Please comment your questions below. I will try to answer them as soon as possible and to the best of my ability. Thank you. Keep safe. While during lockdown, stay indoors.